Hello, everyone. Thank you so much for joining the Sunday Separate podcast again. Yet again, this is season 2, episode 3. For this month, we decided to focus on women heart health, which is in honor of American Heart Month. So we have a specialist here with us today, Dr. Michelle. I'm going to allow her to introduce herself so she can tell you guys a little bit more about her expertise, and then we'll dive into the questions afterwards.
Thank you so much for having me. My name is Michelle Routhenstein. I'm a registered dietitian nutritionist who specializes in heart disease prevention and management through science-based nutrition. Pleasure.
Perfect. But also, she's a triple threat. She doesn't just do that. She's also a cardiology dietitian, prevention cardiologist, registered dietitian nutritionist, and a certified diabetes educator. So we have a very talented doctor here with us to really educate us about the importance of heart health. So how do these skills come together to support heart health, but mainly for women?
Yeah. So when we talk about preventative cardiology and really looking at heart disease, we have to realize something very important. Women, first off, most people don't know that heart disease is the number one cause of death in women over all combined cancers. Most people, if you ask them, they'll say breast cancer is what kills women. But I want you to take a step back and not be frightened by this statistic, but actually realize, okay, heart disease is the number one killer, but hey, did you know 80% of it is preventable when you implement science-based nutrition and lifestyle medicine? We need to be doing better in terms of taking care of ourselves earlier and knowing the risk factors and knowing when we need to optimize them. So everything from your blood pressure to your cholesterol to your blood sugar levels to your abdominal weight, they all matter when we're trying to optimize cardiovascular health because those are very big modifiable risk factors, meaning that through nutrition, through exercise, through stress management, and medication as necessary, we're able to reduce these to target values where we can really reduce the risk of cardiovascular disease and its complications. So awareness is key. A lot of times when you think about the women in general, there are so many different transitions in life, and heart disease can happen in any age and in any body shape. And there's many times in a woman's life, particularly, that we need to be even paying more attention to. Like, for instance, pregnancy. It tells us a lot about heart health. I went to a recent conference, and one of the doctors mentioned how when someone's pregnant, it's a big stressor on their body. And if they have anything like gestational hypertension during pregnancy, or they have HELLP syndrome, or they have preeclampsia or gestational diabetes, it's almost like your body has failed a stress test. And so that is a huge cardiovascular risk factor that often goes unrecognized because it's during the pregnancy or era where the focus is mostly on the human that you're growing versus the mom. And we need to really realize that these risk factors increase, they double the risk of heart attacks and strokes. And so we need to take care of them, and we need to address them timely to really protect the mom and protect the woman.
Thank you so much, Dr. Michelle, especially me being 8 months pregnant. I was not aware of this risk, but it does make sense what you're saying. The body's constantly trying to nurture the infant and ensure that it gets all of the nutrients. So that can definitely affect the mom, and also like her stress level, how her environment is, and how she handles stress can definitely aid to heart issues. I was shocked to hear that heart attacks or other heart issues are one of the main illnesses that women experience. I was not aware of that. So I do thank you for educating us on that. So my next question is, what inspires you to pursue a career focused on preventive cardiology and nutrition?
So I was actually on the path to become a physician, and I had to decide whether I was going to become a doctor or I was going to go through my clinical residency as a dietitian. And I decided to go towards nutrition because I felt that in Western medicine, it's always about treatment with medication. And there's a really big unrecognized arm of how we can prevent when we really focus on diet and lifestyle factors. And so that's where I really that was my interest to begin with, but I didn't really know that until I was in school, the different pathways that I get there. So I ended up niched down into cardiology because during my clinical residency in nutrition, it was just so prevalent of heart disease. Whether I was in the kidney clinic, the liver clinic, I was in the ICU, I was in weight loss clinics, everyone was having cardiovascular complications. And I was like, this is weird. Why is everybody having heart disease issues when everyone has such different ailments and everyone's being in such silos? And I really came to realize that heart disease is connected. If you don't have a good working heart, you don't have blood flow to the other organs of your body. And really focusing on there's a missing link here. Why is it so prevalent if we can prevent it? And that's when I niched down into preventative cardiology, where I worked alongside heart failure specialists, preventative cardiologists, lipidologists to really fine tune and understand the nutrition focus of the medical environment. So, understanding that many medications are actually based off of biological pathways that need nutrients in order for it to work. And so, really focusing in on the vascular space and how plaque forms and how the heart pumps and the heartbeat regularity really encouraged me and inspired me to focus in on the nutrition elements. And I've done this for over 13 years, seeing such a beautiful things happen when people really hone into their diet and their lifestyle that, keeps driving me to do what I do.
It's amazing that you said that, when we think about healing the body, right, instantly we think about medication, but not understanding that through food or proper nutrients, our body can begin healing itself, right? So as I always say, diet is 80%. The other factors are the remainder. So I love that you emphasize that, not enough importance is put into healthy diet when it comes to reversing health issues. So I was very excited that you said that. So thank you. So as a certified diabetes educator, how do you guide women in balancing their blood sugar while also maintaining a heart healthy diet?
It's correlated. A lot of people don't realize that when we talk about heart health, we're talking about cardiometabolic health. And that includes your heart, your kidneys, your metabolism, and your blood sugar control. They all matter. When it comes to heart disease, we don't want what I call havoc in the blood vessel. So if you have high blood sugar levels, you are having more stickier blood. You're having more junk in the arteries that don't belong. And that's going to lead to an inflammatory process that makes plaque more susceptible. It puts more pressure on the heart to do its job, and it can lead to atrial fibrillation. It can actually lead also to heart enlargement and heart failure. We know insulin resistance is a factor to heart disease. And so a lot of people are like, you're a cardiology dietitian. Why do you have a diabetes educator specialist, which actually takes 5 years to develop? You have to sit for another board exam. Like, it's not just a walk in the park. It's a pretty rigorous process to become a certified diabetes educator. And, because it's correlated, individuals who have diabetes are at 2 to 4 times higher increased risk of a heart attack than someone who doesn't have diabetes. And a lot of people don't have diabetes, but they have insulin resistance, which is causing the issue too. And any diet you go on, if your blood sugar levels go down, but your cholesterol goes up, it's the wrong diet. If your cholesterol goes up and blood sugar goes down, we don't want that. We want them all to go in the right direction. That's really when we address cardiometabolic health and we know we're optimizing it. So important to, when we're looking at the right diet, to think about the balance. We need our complex carbohydrates that are rich in fiber. Avoiding them that puts a band-aid on diabetes. We're not getting rid of carbs. We're balancing it with adequate amounts of protein and adequate amounts of healthy fat that blunt the blood sugar rise. So when we talk about more of a balanced way of eating, you're giving your body the right amounts and the right proportions for it to utilize the food, put it into the cell where it belongs, and digest it, so that excess blood sugar, triglycerides are not in the blood vessel where we don't want it to be.
Perfectly said. I have some family members and some individuals I know that have diabetes, and often what I hear them say is, I have to cut back on bread, or I have to cut back on this. And I say to myself, personalized diet is what would be best for them, because each person's diabetes case is different. And I love that you emphasized on how you don't take away the good, but you just portion it and have a balance in the meals that you eat. The meals that we eat regularly for individuals that don't have diabetes is a balanced meal, right? And for those that have diabetes, it's a balanced meal, but it's also to reverse the diabetes. And I love that you're very passionate about educating individuals about proper diet when it comes to aiding with their diabetes, and also emphasizing that no, it's a balanced meal. It's not taking away from one, it's eating more of the good and leaving the bad alone. So thank you so much.
Yeah.
So women often face unique barriers to maintaining health. From your perspective, what are some challenges women encounter, and how can they overcome?
I think a big part is that women are always caring for whether it's kids, their parents, whether it's somebody else. And oftentimes women are on the back burner. And then when you're on the back burner and you're not prioritizing your health until something happens, your body is silently brewing plaque in the arteries. It's silently causing a storm to happen when you finally give yourself a second to take care of yourself. It almost is when a health crisis comes about. So my biggest tip is pause. You cannot give to everybody else if you don't fill up your health bucket. And so you need to set boundaries and prioritize your sleep, your stress, your nourishment. Because without you prioritizing you, you can't give to all the people you love. And so the biggest challenge I find is that women are kind of like, no, I got to do this for someone else. I got to do this for someone else. And they're not looking at, well, what do I need to do for me? And we need to be focusing more on ourselves, because if we show up in a way that is more self, prioritizing our health, our children will benefit from that, our parents will benefit from that, the people we love and care about will benefit from it tremendously. And it teaches a lesson to those around us that we prioritize our health, so you should prioritize it too.
I'm happy that you emphasized on that, because as you said, it's very vital for us to take care of ourselves. So I know that you specialize in preventative care, and that's the cornerstone of your work. What measures should women take to reduce their risk of heart health issues?
Yeah. So I think a lot of times prevention is taken to a way that doesn't always resonate. So I just want to take a step back and really focus on, there's two types of prevention. There's primary prevention, when someone has not had a cardiovascular event and they're trying to prevent one. And then there's also secondary prevention, when someone has had a stroke or a heart attack or a cardiovascular event like a pulmonary embolism, peripartum cardiomyopathy, and they can still prevent future complications. They can still prevent another stroke and heart attack, because their risk is so much higher given they already had one. And a lot of people think, well, oh, I already had one, so I can't prevent anything. And that's actually the worst advice you can say to yourself, because then it's more susceptible to happen and be more harder on your body to recover. So prevention can happen in any person. We like to intervene preventatively as early as possible. In order for us to eradicate heart disease, we actually have to teach our children how to eat heart healthy and take care of their bodies. But you're not too early, it's never too early and it's never too late to be preventative. And I think I want to just emphasize that, because I don't think enough people realize that when I mention the word prevention. Now, to your question, how do we prevent? The easiest and best thing you can do is test your blood pressure at home. I can't tell you how many people have told me that they thought they had white coat syndrome for over 15 years of their life, which when you go to the doctor, your blood pressure is high. And so they're like, oh, you're just nervous to see me. And they say, don't worry about it. And they never checked their blood pressure at home to verify. And when they finally did, it was true hypertension, and it was never addressed, and never, blood pressure is very easily reduced via diet. A lot of times blood pressure medication doesn't help lower it, but diet will. So we do really want to intervene, but we need to know, is it high? How high? We need to make sure we're monitoring it. So get a blood pressure cuff at your local pharmacy. Take it the right way. Take it frequently, every day. Try first thing in the morning. Make sure your hand is well rested on the table when you're taking it. Your feet are flat on the floor. You want to make sure that you know your number and target it to 120/80 or less. It's super important that we do not ignore blood pressure. So that's number one. My number one, blood pressure. If anyone takes anything out of here, it's test your blood pressure every single day in your home. That's one. The second thing is we need to know your cholesterol levels. And you can't feel it. We need to know what's your LDL cholesterol, what's your non-HDL cholesterol, what are your triglyceride levels, what's your risk. If you have a strong family history of heart disease and you have, for instance, a high LP little a, lipoprotein little a, I want that LDL to be less than 70. If you've had a cardiovascular event, I want that LDL to be less than maybe even 55. I want to know your ApoB. I want to know the numbers so that we can target them, because high cholesterol is inflammatory and it can cause the plaque progression to accelerate when we don't know it and we completely ignore it. So cholesterol, blood pressure, inflammation. There's an easy lab you can take called HSCRP that tests for inflammation, low-grade inflammation in your body, and we want that to be less than 1.0 milligrams per deciliter. Know your numbers and know your target. Same thing with blood sugar levels. Check your hemoglobin A1C. Maybe ask for a HOMA IR. Check your waist circumference. It can also indicate inflammation, metabolically active adipose tissue. I want you to check it around your belly button, not your pant size. And we need to target it for women less than 35 inches, for men less than 40 inches. And we need to know these numbers because a lot of times if we just say, well, I don't feel any different, so I'm fine, and we don't go to the doctor, we don't check anything, we get stuck. And not only do we get stuck, we ignore our health, and then all of a sudden a cardiovascular event happens and we had no idea. And we're shocked by it. And this happens to so many people. So I really encourage it. I see people now having strokes in their early 30s. I've seen a lot of people have heart attacks in their early 30s. And if they knew that they had a high risk and they knew that their cholesterol was high for so long, it could have been prevented. So know your numbers, know your targets, and really work at optimizing them. Even if you're on medication, science-based nutrition must be part of your plan, because you cannot outdo a bad diet with a statin medication. You can't. I see in my practice even cardiologists who said, Michelle, I thought a statin would protect me. I've been on a statin for 10, 15 years. I still needed a stent. And they go, only until then did I realize that I never paid attention to my diet, and it really is important that I do. So learn from that. A statin can be very life-saving. It can help lower that LDL cholesterol. But at the end of the day, if you're eating pro-inflammatory foods, the environment of your blood vessels is not conducive for cardiovascular well-being.
You said so many gems in this one conversation, and I'm gonna dive into one of the things that you said. When it comes to individuals that have diabetes, right? They take the medication, but yet they don't practice a proper nutrition. So it's kind of like two elements have to come together for better results. And I do see even people, family members that I have, friends and friends of friends that take the medication because they're afraid that they don't take it, they could die or make the diabetes case worse, but they still eat bread. They still eat pasta. They still eat a lot of cookies and sugary stuff, and their diabetes never gets better. It's still. So I love that you emphasize how two of those elements come together, diet as well as medication. And I'm not against medication, but being a person that was healed through nutrition and holistic lifestyle, medication seems to be the last thing that I go towards. So I do like that you stated that, okay, on top of you taking the medication, but you're not practicing a proper diet, then you wonder years on why your diabetes is getting worse. And as you said, it's very important to practice preventative measures before you have any heart health issues. It's not for those that have diabetes or that have heart health issues that you practice preventative measures is before you have it. And for those that do have diabetes, it's also practicing those methods to reverse the health issues. So I love what you said, so I wanted to jump on that. So can you explain the relationship between diabetes and heart health? Because it can be confusing at times.
Yeah. So when you have diabetes, your body struggles with putting glucose, blood sugar into the cells. So it ends up being in the bloodstream where it doesn't belong. And when you have things in the bloodstream that doesn't belong, it's going to cause inflammation in the blood vessel. It's going to cause more potential for plaque to form. It's going to make the blood more sticky. You're going to have a lot more stress on your heart, your kidneys. We don't want that. So when you have diabetes, what we're trying to do is help your body become more insulin sensitive to help take the blood sugar and put it into the cell where it belongs so that it's not lingering in the bloodstream. When we talk about diet, we want to also recognize, like, for instance, medications are life saving, but diet also really helps to lower the need for higher dosaging of medication over time. So we want to make sure, and sometimes it helps you reduce your medications or eliminate them completely. So we want to be implementing the nutrition component, not just for reversal of diabetes, but also the complications of diabetes, right? We want to make sure we have blood circulation so that we can keep all of our extremities. We want to make sure that we are having good blood circulation so we don't get peripheral artery disease, which is essentially plaque buildup in our legs, which doesn't allow us to walk as well. We want to avoid the complications of heart disease for heart failure because they're all connected. Your body works in one unit. So we need to make sure that we are looking at the insulin resistance and diabetes part of the picture, whether or not your levels are elevated, because we don't want them to become elevated. And we want to make sure we're optimizing your cardiovascular metabolism, your metabolic health to process these foods most effectively.
You definitely explained it in a way where it's understandable, because I myself find myself getting confused. Diabetes, heart health, I know they're associated, but I always wanted to know how. So why are women more at greater risks for heart issues if they have diabetes?
Yeah, so women and men are both at risk if they have diabetes for heart issues because of the inflammatory process, the cardiometabolic dysfunction that occurs that puts more pressure on the vascular system to do its job most effectively. And that's why we really want to be honing into this also alongside cholesterol and blood pressure and inflammation because they're all correlated and they all need to be properly addressed.
Perfect. So how do you approach helping women? I know this episode focuses on women, heart health, with pre-existing conditions like high blood pressure, cholesterol, and making lifestyle changes to improve those heart health issues.
Yeah, so we need to realize that heart disease is a progressive disease. It takes years for it to develop and cause harm. And when we're trying to optimize our heart health, the diet that we are putting in needs to address all of these markers, but also needs to be sustainable long term. So we need to personalize it to ensure nutrient accuracy in order for you to do this long term. So when we say personalize, it's meeting someone where they are. It's looking at their culture, their lifestyle, their work life balance, their accessibility, their budget on food, making sure we're doing something that's sustainable. Because if it's not sustainable, then it's not going to be effective. And that's a big part of it. So when I work with my clients, I take the science and I personalize it into their lifestyle to make sure that we're doing this that can last long term, but that we're choosing habits in a slow formation. So I look at 3 to 4 goals at a time. What do we need to prioritize here? So depending on the person, depending on, what their non-negotiables are, we'll come up with 4 things that we need to focus on. And that way we can assess challenges. We could assess what's working. We could assess what's not working, and we can pivot and I can provide suggestions to help get them to their goal. But it's an important process to go through because you can't just give everybody as one pamphlet and say, hey, this is what you should and should not eat. It doesn't work. We really need to meet people where they are and personalize the diet to optimize their cardiovascular well-being.
Yes, I completely agree, especially the part where you said that it's personalized nutrition, right? Based on one's lifestyle. And most of the times, individuals that have heart health issues or diabetes, high blood pressure or cholesterol, the first step that makes it hard to reverse the health issue is finances. I don't have the money, or my lifestyle is too busy. And I love that how you work with them in a way to embrace their lifestyle and their culture, to let them know it is attainable. It is possible for you to reverse or manage your heart health issue or your diabetes or high blood pressure or cholesterol and in a sense, making it personalized for them so that it is achievable. So I do admire that a lot. What particularly nutrients or supplements are often overlooked but essential for maintaining our health?
Yeah, so I'm a food first practitioner. When we look at the research, we're really looking at putting in foods first. The supplement market is not as regulated as it should be. And a lot of times there's fillers, there's heavy metals, there's a lot of things that can cause kidney failure, liver failure, and a lot of these high dose types of supplements. So I give supplements as needed. So if someone comes to me and says, "Hey, Michelle, I want to be vegan," I go, "Okay, that's fine. But we need to supplement because there's certain nutrients you can't get on a vegan diet. Someone avoids a certain food group and we can't get it through diet. Yes, we supplement, but it's not something that everybody should. If you see one of those heart disease magic pill claims that this is going to help your heart, question it, because there's no such thing. The supplements need to be personalized as well. But we look at specific nutrients. There's a lot of nutrients, right, that we need to get, and it'll all depend. For instance, if someone has heart failure, a lot of times they're deficient in iron. And we know that if they don't have enough iron, that can increase their workload on their heart and progress heart failure quicker. Many people who have osteopenia, osteoporosis, are deficient in calcium and magnesium and vitamin D. We want to make sure that they're getting enough of that for optimal bone health. Because if you don't have strong bones, or if you have osteopenia or osteoporosis and calcium is being leached out of your bones because you don't have enough adequate intake, that can cause vascular calcification and negatively impact the heart. So it's important that we're looking at all of the factors and assessing kind of where you may be deficient in. But your heart needs everything from potassium, calcium, magnesium, protein, omega 3s, vitamin E, vitamin C. We need all the vitamins and minerals for our cardiovascular well being. But we want to make sure that it's the adequate amount for you. And we need to make sure we're really looking at seeing where there potentially lies a deficiency so that we can correct it effectively.
Thank you, Dr. Michelle. So, for women juggling family, career, and personal wellness, what strategies do you recommend for staying consistent with heart healthy habits?
Anchoring it into your schedule. Okay, a big part of it is I'm a mom to 4 boys. I run a business. I'm a busy person. And if I don't anchor in my habits, they will not happen. And I teach this to all of my clients. So, for instance, if you know, wow, I don't move at all, don't have a goal of 60 minutes a day. You're not going to do that. Start with 10 minutes. Maybe you can anchor it. Like for me, I answer all of my client emails in the morning. I get in my office at 8 and I will walk on my walking desk from 8 to like 8:45. And I'm like busy typing away. Sometimes I don't realize, oh, it's 9 o'clock. I have my appointment. I just got off my walking desk. Like I've anchored it in where I check emails and I walk in the morning, and I know at least I get my a little bit of movement to start off my day. But just anchor it in. Maybe it's 10 minutes after your biggest meal that you take a walk. Find the time where you say, at this point in my time, you're going to eat dinner. Maybe that's when you walk after that for 10 minutes. Like find little anchors of time and little pockets of time where you're not asking a big ask. Don't put a goal of 30 minutes. Go with 5 minutes to begin with. Anchor it in, and then you can add more and more. So a lot of times we think we got to overhaul our diet in order for it to work. We got to change everything. And so we're just like, nah, can't do it right now. But what if we took a different approach and said, hey, I need to make small change. And if I make small changes regularly, that will have a big impact on my health and make that more realistic, more approachable. And that's where I want to focus on.
Yes, I love those methods. Particularly some of us, we want to accomplish everything in one day, right? Because we're balancing the household, our kids, our husband's needs, so many other things that we think we can do everything at once. And I've been guilty of that. And I love how you said that. Setting those 5-minute realistic time frames can help you achieve your goals more quicker than trying to set unrealistic time frames that can make you feel burnt out and not reach your goal overall. You also work So your work also involves educating patients. What are the most common questions or concerns women have when they come to you about nutrition for our health?
They're confused. The internet is the Wild West these days. Like one person tells you this is what you eat, the other person tells you don't eat that, it's going to kill you. People, there's so many women who literally stop eating because they're scared. And we need to nourish our bodies. And so a big part of it is explaining the why. Why do we want to eat this? It's debunking a myth, but not saying, oh, trust me, I'm the expert. No, don't trust me. Ask me why. I'm going to tell you. And that's important. When you understand the biological mechanisms of why one food is going to help you versus harm you, you're more susceptible to eating it. When you hear someone, an influencer, saying, yo, don't eat this, but they don't give you an explanation, or they give you a crazy explanation that makes no absolute sense, take a step back and be like, that doesn't make, wait a second, this isn't sound right. So I would really focus in on kind of where you're getting information and really understanding the why behind the nutrition, because there are so many things that are out there on the internet these days that are really harmful.
I completely agree. Listening to trends and people telling you what to eat, what not to eat, at some point you're going to think we can't eat anything, right? And
Yeah.
that's where I've been hearing a lot. Like I saw this commercial where a woman was picking up an apple, then I guess it's her subconscious talking to her saying, you know, you can't eat those fruits because it has all those bacteria on it. Then she throws it down. And then she goes and drinks water. Why are you drinking that water? You know, it's in a plastic container. It's like, it's always something. But
Yeah.
as you said, it's about knowing what's best for you and knowing to trust your specialist to know that they know how they're assisting you, what they're doing, but also doing your own research, right? Not relying on somebody else to help you.
No. So I think that you need an expert to guide
Yes.
you, but you need someone to explain the why.
Yes.
I have clients who've gone to naturopathic doctors who've put them on one, like the carnivore diet, then they put them on the vegan diet. How does one practitioner put you on two completely opposite diets? Like they have the credentials, but they didn't explain the why, and people aren't asking the why. Ask the why. Ask the why. If someone puts you on a restrictive diet for a long period of time, that is never a good thing. Be asking questions. Why am I on this? Why do I need to do this? For how long? Ask educated questions. I spend so much time educating my clients on why. Why should you eat this versus not eat that? What's it doing in your body? What's it doing in your liver? What's it doing in your pancreas? What's it doing in your gut? We have to know the why. And that you can't just read a bunch of things, because if you don't have, I've been doing this for over 13 plus years. I have the experience to understand how to read research. There's a lot of influencers who are cherry picking data that have the wrong message because they're just choosing what they want to say when it doesn't even tell you that in the research paper. No one's second guessing them. Nobody's saying why. And when someone asks why and they get blocked, that's a red flag. I went up to Dr. Gundry at a conference and I said, why do you tell people not to eat beans? Do you have any data? Do you know what he did? He ran away from me.
What?
Like, if someone's not going to approach the topic, like, I'm ready to have a conversation with you. We just need to be open and honest. Someone blocks and runs away from a solid question. That's not going, that's a red flag. We got to use our sensors. We can't just take whatever someone says, or oh, that guy looks good, he has a six pack, I'm going to do what he's doing. That's not how it works. We have to understand how it biologically works and our physiologically works in our body, and we have really good robust science and data.
Yes, I completely agree. Dr. Michelle, ask why and know the reasoning behind it. That's very important as a first step in reversing or tending to one's health issue. So how do you personalize heart health recommendations for women based on their cultural and diet preferences?
Yeah. So in my practice, my first initial conversation, or before I even see the person, I'm looking at their medical records. I'm looking at their supplements, their medications they're using. I have a good understanding of their medical profile, and then I'm asking them a lot of questions. I'm asking them, tell me about your day to day. Tell me about your cooking style, your weekends. Tell me about what the foods you like, the foods you dislike. Tell me about the cultural foods that you have. Like, we go through a lot of these things and the intake, the 90-minute intake that I have with them. And that allows me to take the science and their lifestyle and merge them together. So we have to meet people where they are. But we have to understand, what do they like to eat? If they don't like certain foods, it's not going to work. If someone doesn't have a certain type of culture, you can't just give them the Mediterranean diet, for instance. It doesn't work. We have to meet people where they are. And that really takes the time to listen, hear them out, and create a devised plan that really merges the two together.
Yes, as you said, treating the whole person, right? Looking at their cultural habits, but also where do they come from? And like you said, you can't introduce somebody that's from East Africa, Middle Eastern food, because it's like, have they ate that before? Do they know what that is? And it's like, you can't just tell them this is what you're supposed to eat. And they're like, I've never ate this before, which makes it harder for them to really stick to the diet that you're trying to help them achieve to have a better outcome. So
Exactly.
thank you for emphasizing the importance of that. Are there any misconceptions about heart disease prevention or treatment that you would like to debunk?
I mean, there's a lot of things to debunk, but I guess it's really the fact that, a lot of times people will say, "Oh, my cholesterol's high, it must be genetic." And there is a genetic lipid metabolism disorder called familial hypercholesterolemia. And while that is genetic, there's still a nutrition component. And so a lot of times when people say, "Oh, it's genetic, my doctor said it's genetic," or my blood pressure is genetic, like, okay. And then they're like, "I can't do anything about it. My doctor says I can't." Like, no, 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 no. Science-based nutrition always comes into play. If you have genetic hypertension, science-based nutrition is more important. If you have familial hypercholesterolemia, it's more important because your body's struggling. It can't genetically do what it's supposed to do. And so if you just eat whatever you want, you're putting a lot of fire in that. You're putting a lot of fuel to that fire, and we don't want that. So whether we have genetics or not, heart disease, proper nutrition needs to have a role here. And yeah, the medication regimen may be a little bit different, but if you don't add in the nutrition component, you're going to be on very high dose of medications, which can lead to long-term side effects that don't allow you to stay on it long term. So really important that you take care of your heart through nutrition and lifestyle, regardless of if there's a genetic component or not.
Yes, I've heard that as well, where some individuals would say, "My dad had high cholesterol, so I'm just prone to it," or "My mom had diabetes, so I'm prone to it." But a lot of it is connected to your lifestyle choices, right? It could be 50-50 that you get it. It could be 100% that you don't get it. But as you said, it's about preventative methods. It's about living a healthy lifestyle so that you don't heighten the chances of getting that particular or other heart health issues that runs in the family.
But even if you have genetic hypertension, if you don't take care of your body through nutrition and diet, you won't control genetic hypertension without a lot of medication. And that really can lead to some side effects in many people. So we need to recognize that if you have a genetic predisposition to heart disease, let's say your body makes more plaque. Like, for instance, I have high LP little I, lipoprotein little I. My body likes to make more plaque. If I don't do anything about it, my body will make plaque very, very aggressively. But with diet, I push down all of my levels so that I'm down regulating my genetic predisposition. And we know in the research, when we down regulate our genes by diet and nutrition, we are in less risk than someone who has no genetic predisposition but has all of these risk factors that are uncontrolled. So there's a genetic component that way. But there's also genetic cardiomyopathy. There are things that we are born with, we cannot change. But if we don't add nutrition to those places, it will make the condition work. Our body will be under more stress. So nutrition always has a role. Whether we have disease, we don't have disease, we want to prevent complications.
Thank you so much for emphasizing on that, Dr. Michelle. How does your approach differ when working with women at different stages of life, such as pregnancy, menopause, and aging?
Yeah. So we're going through different transitions in life, and it actually will change the risk profile of women in different places. So, for instance, when someone is pregnant, we're really looking at making sure before they're pregnant that they're exercise capacity, their nutrition is optimal, both for the growing baby, but also for the mom's body. The body now has to make a lot more blood supply. And so the heart is under stress. And so we need to make sure that if someone is pregnant, that they get preconception testing if they're at high risk of heart disease. We also, postmenopausal, need to assess the mom's risk and make sure she's taking care of herself so she doesn't end up in heart failure or heart failure like complications. In terms of menopause, as we age and estrogen declines, our bodies are more prone to become insulin resistant. It's more prone to get more body distribution, fat distribution around the abdominal region. It's not inevitable, but we know that our protection of estrogen is declining. So we have to be even more protective in order for us to avoid cardiovascular disease. As we get into menopause, our risk is now the same as a man, but men's risk is 10 years younger because they don't have the estrogen that's protected them beforehand. So we need to make sure that as we age, as we're looking at all these life transitions, that we take a little bit of attention to make sure we're taking care of our heart so that we can prevent those complications associated with life's transitions.
So what role does community play in supporting women's heart health? And how can women build support systems around their wellness goals?
Yeah. So community is huge because, if we're doing this with someone else that's holding us accountable, we're going to be that much more successful. I have a community group called Optimize. It's a group program where I give lectures. But the thing I love the most is the community. When you see people going, oh, there's other people who are just like me, it gives them a sigh of relief of like, okay, we're in this together. We got each other's back. We're going to overcome these challenges, these fearful anxieties that come with heart disease. So supporting connection is huge, or else you feel isolated. And we know when we are depressed, isolated, feeling alone, our risk of heart disease goes up, our stress goes up, our anxiety goes up. Connection is such a big, important component to quality of life, but to stress reduction as well. And so we do need to prioritize a community that supports our goals and that positively influences our health, because that's important for us to maintain all of the efforts that we're putting into this.
I have had a pleasure of having you here, and you've educated us so much about the importance of heart health, diet, preventative measures, and so on. But before we go, what words of wisdom would you leave with our listeners, or words of recommendation before we end the interview?
Yeah. So be proactive in your health. Know your numbers. Make sure that you understand them. Make sure that you understand your risk and take action as early as possible. And that means today, one small thing that you can do for your heart so that we can help reduce the risk of heart disease and heart related complications. We can reduce this. We can increase quality of life, but we have to be proactive and we have to be looking at the whole picture of cardiovascular well-being.
Thank you so much, Dr. Michelle. It was such a pleasure having you on our podcast, and I can't wait for our listeners to really chime into all of the advices that you are giving us. And this episode, which is episode 3, is the last episode that focuses on Women Heart Health Month, and we wanted to end it with Dr. Michelle. So thank you everyone for tuning into our podcast. Please make sure you share this episode and all of our episodes with your family and friends, and thank you so much for your support.
Thank you.